Good day, everyone.
Good morning, doctor.
My name is Dr. Hakimi and I am a Safety and Health Officer that will teach you all about prevention and management of HIV/AIDS. Are you guys ready?
Yes, we are.
Good. Let's start now.
What is HIV? What is AIDS?
Human immune deficiency virus HIV causes acquired immune deficiency syndrome AIDS. The virus attacks the immune system of the body and eventually causes failure of the immune system to protect the body from various infections and cancers. The time period from the exposure to HIV to the onset of the acute clinical illness ranges from 21 days to 6 months. You can get HIV via unprotected sex, pregnancy, childbirth and breastfeeding, injecting drugs, working in healthcare and blood transfusion and organ transplants.
How healthcare worker can be exposed to HIV?
Healthcare worker can be exposed to HIV through percutaneous or mucocutaneous exposure. Percutaneous exposure occurs when the skin is cut or penetrated by needles or other sharp instruments. Example of the procedures that can cause this exposure are drawing blood from the patient and setting of intravenous IV line of the patient. Mucocutaneous exposure is when blood or other body fluids contaminate the eyes, the inside of the nose or mouth, or an area of non-intact skin.
How to prevent exposure to HIV.
Exposure to HIV can be prevented by do frequent hand washing using soap and water. Wearing appropriate personal protective equipment PPE like gloves, face mask, goggles and apron during procedure. Proper housekeeping and management of spillage. The spillage should be covered by sodium hypochlorite and left for 5 to 10 minutes before clean it. Disinfection and sterilization of patient care equipment by autoclave or boiling for 10 to 30 minutes. Proper management of soiled or contaminated linen where the staff must wearing gloves when handling the linen. The soiled linen should be placed into appropriate laundry bags with biohazard label. Disposal of sharp wastes into sharp containers and infectious or contaminated wastes into yellow clinical waste bags or containers. During intravascular procedure, further precautions is needed because there are more risk for exposure. The healthcare worker can wear double gloves for more protection. Using a closed system tube like a vacutainer when drawing blood is recommended because it decreases the risk of exposure. Any gauze used must be discarded in clinical waste bag. Transferring of blood to container need to be done slowly and carefully to avoid any spillage. Lastly, the needles should not be recapped. Percutaneous injury can easily happen when the needles is recapped.
What to do after exposed to infected blood?
For percutaneous injuries, blood should be expressed out by squeezing the tissues adjacent to the wound and immediately washing it thoroughly with soap and running water. The wound should then be disinfected and dressed. If blood or body fluid gets on the skin, wash well with soap and water. If the eyes are contaminated, rinse the area gently but thoroughly with water or normal saline with eyes open. If blood/body fluid gets into the mouth, spit it out and rinse the mouth with water several times. After that, injured healthcare worker should report to the location supervisor immediately after the injury has occurred for documentation. Then, the location supervisor will refer the exposed healthcare worker to the designated doctor immediately for risk assessment and treatment. Lastly, the location supervisor will notify the incident to Occupational Safety and Health Committee and will record the incident in the Sharps Injury Management Registry.
How the risk assessment will be done.
The risk assessment will be done by doing injury assessment first. The injury will be evaluated for its potential to transmit HIV based on the type of body substance involved, the root and severity of the injury. The second step is source assessment. The HIV status of the source must be ascertained. If the status of the source individual is unknown at the time of the accident, then baseline testing will be undertaken immediately to determine the source infectious status for HIV, by testing for HIV antibody ELISA. The last step is healthcare worker assessment. The exposed healthcare worker will have baseline testing for HIV by using ELISA to check the presence of anti-HIV antibody in the blood. Counseling will be given and informed consent obtained before testing is done. The blood, which is collected from the healthcare worker, may be stored for future testing if required.
What is the treatment for exposed healthcare worker?
Not all exposed healthcare worker require treatment. The treatment will be given based on the source of the exposure. If the source negative for HIV, only counseling and blood collection for baseline serological studies will be done. If the source has unknown infectious status or the source unable to be tested for HIV, consider the source as high-risk group. Post-exposure prophylaxis PEP medication will be given. Retesting anti-HIV ELISA of exposed healthcare worker is required at 6 weeks, 3 months and 6 months interval. If source is likely to be in the window period for HIV. Retesting anti-HIV ELISA of the source and exposed healthcare worker are required at 6 weeks, 3 months and 6 months intervals to check for seroconversion. Lastly, if source is positive or likely to be positive for HIV, post-exposure prophylaxis PEP medication will be given and retesting anti-HIV ELISA of exposed healthcare worker is required at 6 weeks, 3 months and 6 months intervals. Medication that used for post-exposure prophylaxis are zidovudine, plus lamivudine, or the combined one called Combivir. The medications will be commenced, where indicated, or if a delay in obtaining test results is anticipated, or when the source patient belongs to the high-risk group.
What happened if the healthcare worker tested HIV positive?
In the event that a healthcare worker develops seroconversion, he or she will be referred to the physician from the relevant discipline like hepatologist or infectious diseases physician for clinical management. He or she will also be referred to the hospital director or medical officer of health for occupational intervention. That's all for today. Thank you guys for attending my seminar.
Thank you, doctor.
You are welcome. Goodbye.
Goodbye, doctor.